Hello, I'm Dr. Peter Hosen, board-certified ophthalmologist here at Tayani Institute. Today we'll be talking about corneal injury, specifically chemical burn and corneal foreign body. In a chemical burn, either an acid or a base can be splashed onto the eye inadvertently. The mainstay of treatment is copious irrigation at home or at the work site. If you do seek care at the emergency room, they will also copiously irrigate your eye. After the copious irrigation, an ophthalmologist will perform a thorough exam of the cornea to determine the extent of the chemical injury. If the area of the burn is small, then antibiotic drops and ointment will be prescribed to allow the eye to heal without the risk of infection. However, if the area involved is quite large, a bandaged contact lens may be applied to the eye to promote healing. Antibiotic drops and ointment will still be applied to reduce the chance of infection. Follow-up care is very important to reduce the chance of infection and make sure that the burn area is adequately healing. We also ask the patient to take an increased amount of vitamin C orally to allow the abrasion to heal appropriately. Next, let's talk about corneal foreign body. Typically, this occurs when someone is hammering metal on metal or grinding. This can also occur from weed whackers or anything high velocity when we're doing gardening. Often these patients are referred from emergency rooms where they are diagnosed with a foreign body. However, the foreign body cannot be removed adequately by the emergency room physician. They're referred to us for further care. Your eye care professional will examine you with our microscope. If it is determined that a foreign body is in the cornea, we will remove the foreign body for you. Drops of topical anesthetic will be applied to your eye, and then with micro-instrumentation, the foreign body will be removed. If the foreign body is metallic and has been there for several hours, it may leave behind a rust ring. This rust will have to be removed with our microsurgical instruments. If the rust is left behind, the skin of the cornea will be unable to fully heal, and additional therapy would be indicated. Following removal of the foreign body, we would treat the injury just like a corneal abrasion through antibiotic drops and ointment. Careful follow-up is important to reduce the chance of infection following the removal of the foreign body. Well, I hope you found this information useful. We look forward to taking care of you here at Tayani Institute.